What we'll do over the next 15 minutes is look at where India is in its battle against the coronavirus from a medical perspective. I want to show you on that screen behind me the Indian coronavirus curve vis-a-vis the curve of other countries. And when you look at this, you will get a sense of how India is just at the same position where the United States was. So can I have that data chart on our screen, please? And I want you to look at India, which is in this dark orange color, and then look out for the United States, which is a lighter shade of orange. If you look very carefully, around 100 in the y-axis and around 15 on the x-axis, you will see India and the United States virtually at the same place. From there on, the United States spiked, and India, we don't know what will happen. But we're virtually at the same kind of position, eerily so, which is why what will happen over the next 72 hours is so very crucial. Will we go the US way, or can we flatten the curve and bring it towards South Korea and Japan, which is what really we're hoping to do. Joining me at this moment for a medical perspective on the battle against the coronavirus is Dr. Ashish Jha, the director of the Harvard Medical Center. He's been live on global television giving his insights on the world's fight against the coronavirus. Really benefited from his insights last time round. Delighted to have him again. Dr. Jha, welcome. Also with us, the one doctor who the entire country looks up to, his word is taken as gospel by many of our viewers. Dr. Naresh Trehan runs Medanta Medicity. He's joining us on this broadcast. Doctor, welcome. Sudarshan Balal is the chairperson of the Manipal Institute. He's joining us as well. Before I go across to this phenomenal panel of doctors with us tonight, I want to show you what happened in Bhilwara in Rajasthan, one of the original hotspots in Delhi, in India, a hotspot which controlled by what's now called the Bhilwara model and is being widely touted as a model that could be extended to other parts of the country. Before you really understand what that means, let's just try and go back to Bhilwara and show you what happened in Bhilwara and how this can impact what may happen in your patch after the 14th of April if you've seen a few coronavirus cases. Here's our report.
From 0 positive coronavirus cases in March 18th to 26 on March 30th. Rajasthan's Bhilwara once seemed to be headed towards a large-scale outbreak. But then this Rajasthan district witnessed a turnaround. In the last 8 days, the number of coronavirus cases in Bhilwara have risen by only 1. Out of the 27 positive coronavirus cases in the district, 17 have been cured. Out of these 17, 13 have been discharged. So what worked for Bhilwara? As per the health department, more than 6,50,000 homes and more than 24 lakh people have been screened in urban and rural Bhilwara. The district administration acquired all the hotels in the district and brought it under its jurisdiction. These hotels were turned into quarantine centers where 960 people were kept in quarantine till April 4th. Currently, 730 people are kept in quarantine. One private hospital in the district has come under the scanner as 17 medical practitioners working there tested positive. The hospital was sealed and the concerned medical staff isolated. The authorities imposed a curfew and a complete lockdown strictly. The district borders were sealed and the movement of public and private vehicles stopped. What followed was mapping of positive cases and their contacts, followed by identifying clusters and secondary level contacts.
हमने तुरंत कलेक्टर को एडवाइस किया कि आप पूरा कर्फ्यू लगा दीजिए, पूरे शहर में धारा 144 लगा के बॉर्डर सील कर दीजिए, सिटी सील कर दीजिए। इससे ये हुआ कि जो संक्रमित लोग सिटी के अंदर हैं वो अंदर ही रहें और बाहर वालों को ना हो। उसके बाद हमने जितने भी पॉजिटिव केसेस थे उसकी बहुत इंटेंस कॉन्टैक्ट ट्रेसिंग करवाई, वो किससे मिले, कैसे मिले, सीसीटीवी फुटेज वगैरह भी देखा गया और इन लोगों को तुरंत आइसोलेट किया गया। बाकी इनसे जो और संक्रमित लोगों की संभावना थी उनको क्वारंटीन किया गया।
A combination of ruthless containment strategy, timely action, total screening in rural and urban parts, coupled with strict enforcement of curfew and lockdown restrictions, brought Bhilwara back from the brink. The government of India has recommended that Bhilwara's example be followed.
Strategy action plan हम लोगों ने स्टेट को और डिस्ट्रिक्ट के सारे डीसीज को भी ओरिएंट किया था। इट इज़ सो हैप्पी टू नोट कि हमें कुछ स्थानों पर उसके रिक्वायर्ड रिजल्ट्स भी आ रहे हैं, जैसे कि आगरा, भीलवाड़ा, पूर्वी दिल्ली और मुंबई में उस एक्शन प्लान के तहत और इसी तरह सभी जिलों में उस एक्शन प्लान के तहत काम हो रहा है।
The Bhilwara model is now emerging as an ideal model that can be implemented in hotspots across the country. With Devankur in Bhilwara, Bureau Report, India Today.
So what do the doctors feel about what India's strategy should be from here on? Dr. Naresh Trehan, chairperson of Medanta, Dr. Ashish Jha, director of the Harvard Medical Center, and Dr. Sudarshan Balal, who runs the Manipal Institutes, now join me on this broadcast. I want to show you two charts compiled by the India Today Data Intelligence Unit which set the context for this conversation. This is the state-wise breakup of states that are most impacted. This red curve, and I want our camera to come in as close as you can. This dark red curve is that of Tamil Nadu, where there's been a big jump. Andhra Pradesh seeing a big jump. Rajasthan in pockets seeing a big jump. Now, look at this dotted line. This is the two-day reference line. What this means is the closer your state is to that dotted reference line, the faster cases are growing. Now, this is the two-day reference line. This slightly flatter dotted line is the 5-day reference line, which means that if your state, like Kerala is at this moment, like Uttar Pradesh is mercifully at this moment, if your state is closer to this dotted line, then cases in your state are growing at a slower speed. This is the state-wise breakup. I can show you a city-wise breakup as well to give you a district-wise sense of the areas that are most impacted. And there you've got districts like Kasaragod in Kerala, which are deeply problematic. You've got districts like Greater Noida, which are deeply problematic. And those have been major areas of concern. So here are the districts where we've seen a sharp spurt. So there's been a sharp spurt in Kasaragod, there's been a sharp spurt in Indore. Delhi and Mumbai remain vulnerable. Bangalore, Chennai at this moment, mercifully better off. So I want to go across first and foremost to Dr. Ashish Jha, director of the Harvard Medical Center. Dr. Jha, the government at this time seems to be very significantly mulling the possibility of extending the lockdown. Do you believe this would be the right thing? Most people watching this broadcast have had enough of this lockdown. They'd like their lives to get back in order. However, if it's really required and if it's a matter of life and death, they'll have to deal with the consequences of the extension. What, in your view, would be the right strategy for India? What do you think of what the government's doing? Dr. Jha.
Yeah, so thank you again, Rahul, for having me on. Whether to end the lockdown, where to end the lockdown, selectively in some places or in others, really has to be guided by evidence and data. And data and evidence comes from having, and I've discussed this before with you, having extensive testing. What that will do is give the government, give chief ministers, the prime minister, the whole political leadership and the medical leadership a very good view on how much disease there is in every community. I look at the numbers that you show, and Uttar Pradesh looks good. But the question is it because there's very little disease transmission, or are we just not doing enough testing in UP, and that's why we're not seeing the cases? So I think it would be really helpful to get some more information. Extending it a little bit longer seems like a reasonable thing to me, but as you said, very difficult for people, especially poor people, to stay in lockdown. So I would like to see us unlock, but when we have the data.
Rich people and poor alike, Dr. Trehan, would like this lockdown to end. We've seen countries like Sweden adopt social distancing, as also the Czech Republic. People stay away from each other, they're careful, they wear masks, and life kind of gets back to normal. Can that be the view that we follow in India? What do you make of the fact that there are sources in government who are indicating to us that an extension of the lockdown is inevitable? Would that be, Dr. Trehan, in your view, the right thing to do?
So, like Dr. Jha said, that basically we have to be data-driven. What's happened is that extensive testing, or increased testing, I would say, has only happened in the last 2-3 days. So we are still ramping up the testing, and I think that we have up to about 12th of this month to really collate the data as it's coming in, because you must understand there's a lag period also from the data coming in at the right time. So if by 12th the indicators are that there is extensive spread at the community level, then of course there's no choice but to extend the lockdown for another week, 10 days, 2 weeks, depending on what the data shows. However, if the data reliably indicates that generally there is not that wide and deep a spread, but there are hotspots, then we will have to think that should we keep the hotspots locked down for extended period and try to phase a unlocking over a period of the next 2 to 3 weeks. So both plans have to be made. The basic thing is, how do you restore normalcy over a given period of time, and what should be the sequence? Much like what happened in 2008, that America did the quantitative easing for economic purposes, we have to do a graded unlocking over a period of time by actually taking, say, for example, today we have the essential services are working. Then on the other hand, we have a whole lot of industries, businesses locked up. So we need to give them priority to say what should be essential services -1, which should go first. So this planning is being done right now. But I think that as much as we are hoping that we do not find a widespread evidence in the community level, that we may be opening in the next week, 10 days. I think we should be very, very dispassionate about everything else except saving human lives.
No, but this,
Our whole
Dr.
concern
Balal,
should
is
be
actually a catch-22
what is the right
situation.
thing to do given the data. That's it.
You're both asking for data, but we don't have adequate data because testing in India is very limited. We are ramping up. If you look at the baseline, we've really increased the amount of testing, but if you look at how many people there are in India, the testing is still a very small fraction of what it should be. We don't have that data. Both Dr. Trehan and Dr. Jha are asking for more data. At this moment, we don't have data.
We extend it.
Dr. Balal, your view, in the absence of data, you think extension
by
is...
the 12th you don't have enough data, then you extend your lockdown.
Good evening, Rahul, and good evening to my distinguished panelists. I think both Dr. Jha and Dr. Trehan have mentioned that we have probably not done enough testing. Be as it may, for the facts we have is quite clear that the lockdown is working. To give you an example, in the state of Karnataka, the infection rates, if you believe the number of tested people are inadequate, even then it's about 3 per million or less. And the mortality is less than 1 in 15 million. And you cannot hide deaths. So even if the testing was not enough and we haven't picked up all the cases, I think it's very difficult to say that the mortality was much higher. So I do believe the lockdown has been very effective, probably more effective in some states than the others. And some form of lockdown may have to be continued till such time that we get more data. Obviously, the essential services are pretty much open now. Maybe there's scope for some tweaking of what we do. But I personally believe that many daily wages are undergoing a lot of hardship, and we should seriously look at to see how we can support them, even if the lockdown is partial. By and large, we have done much better than most countries, and I hope we continue to do well. And except for those pockets in Delhi and a few other places, we would have probably beaten the disease by now.
At this time, Dr. Jha, there are 3.9 billion people across 115 countries of the globe who are under some form of lockdown. That's 1/2 of humanity. You're looking at the global picture. Which country do you think is closest to India in terms of the lockdown model that they implemented, which you think could provide lessons for Indian policymakers to look at? What would be the ideal thing for India to do? Because we've got, as I showed on that COVID map of India, areas where you've got COVID hotspots and some places which are completely unscathed. People there would be wondering, hey, why are we locked down? More people are dying just by crossing the road ordinarily than they are of coronavirus. Why do I need to deal with the consequences of a lockdown?
Yeah. No, so India actually, it's interesting to me, has taken a different approach than any other country. And let me explain why. South Korea, Taiwan, Singapore did a very aggressive early testing strategy, ramped up testing, and mostly they were able to avoid a lockdown. Countries like Italy and Spain and the United States have done lockdown, but much later. They waited too long. And so the lockdown has had some effect, it's working, but it's taken a long time. India, I think, has very smartly locked down early to give itself time to ramp up testing. Now the question is, will India use that time and that it has bought itself to effectively implement the model that we heard about, where you do extensive testing, you do the extensive contact tracing and put the hotspots out? And that is a great model. It's very hard to do. The question is, will India be ready to be able to do that? I will make one other point. You can hide deaths. Sometimes we think, well, at least we can track deaths. But in India, actually across the world, but certainly in India, many people die. We don't know why they died. They never go to the hospital. If they go to the hospital, they don't get tested. So I am worried that there's more disease in the community than we are aware of. I think the lockdown has been great. I've been very supportive, but we cannot lose this time, because the moment the lockdown gets released, the virus will come back. The virus is not going away. And so we need to use our time to prepare for staying open, not just opening up, but staying open. That's the challenge in front of us.
Dr. Trehan, how's life been at your hospital outside of the lockdown? There's been some anecdotal talk of how there are fewer patients coming in for emergencies, fewer patients coming in with heart complaints. Now, that's obviously not linked to just the lockdown itself, but what are the reasons you attribute to fewer cases of emergencies coming in outside of what we are seeing because of the coronavirus? Can you tell us what's been happening at your hospitals?
So there are multiple factors. One, if you look at emergency rooms, about 20% of the patients come from road traffic accidents or trauma. Now, as you know, the roads are empty, so that 20% is not there, and it's a good thing that they are not there. The second thing is that people who come to the emergency room with, say, other kind of bellyache, all this stuff, they are going to the local hospitals, not to they can't travel, so they are actually being treated in whatever way by their local physicians or whatever. So, but we are still getting at least 60-70% of the patients are still coming. And in a hospital like ours, which is a super specialty, we get all the emergencies, heart attacks, the intestinal obstructions, the cancer patients, so and people who are in crisis with any other infection. So we get enough patients right now, but they are of a different variety, which is, say, if we were treating 150 patients a day in our emergency room, today it will be around 70-80. But at the same time, is happening in the community by way of, are we seeing a spurt in patients with symptoms of COVID-19 coming in? Most definitely. So you're hearing in the last couple of days more and more people seeking hospital admission because they are either not well or they are in another hospital and want to get transferred. So this is just a small experience that I'm sharing with you, but there are signs. See, the important things of this lockdown, of course, it was a bold move, very well done. But we are seeing cases today who are still in that 14-day window where they may have got infected before the lockdown happened. Now, the data that is more important is to say, when those 14 days have gone and we have eliminated the ones who got infected before the lockdown, we will then get a fair idea of how many people are getting infected today with the lockdown. And life is not going to be the same after the lockdown is opened. We are still saying you will have to wear masks. You know, like this, I'd like to clarify, not surgical masks, not N95, but cloth masks or any non-surgical mask will do. The whole community should wear masks when they are out of their house.
Dr. Balal?
The other is social distancing will have to be maintained for several months from now.
How's things been at the Manipal Institute? We're looking at the big picture. We've looked at the pan-India macro data. Can we just go down to where you're at? What are you seeing when it comes to other cases and the coronavirus?
Rahul, our experience has been a little different from that of Dr. Trehan. As you're aware, Karnataka has a reasonably good control over what is happening. And our own experience is that obviously we are not seeing any increase in the number of not only corona patients that we test with necessary symptoms and the history, But even other respiratory illnesses, we have seen less number of people coming in for various reasons. One, maybe there is the social distancing, cough etiquette, general cleanliness, so on and so forth. The other important thing is that we have, at the Manipal Group, opened a separate COVID hospital with more than 100 beds in our university town of Udupi and Manipal. And to be honest with you, we have had only single-digit numbers over the last week to 10 days for a hospital that has a capacity more than 100. And even our fewer clinics are not flooded with the COVID-like or respiratory symptom associated patients. So I do believe that the numbers have not gone up, at least from what we have seen. And I think there's also an underutilization of the government facilities. We have close to 2,000 beds in Bangalore alone of government hospitals. And I'm given to understand they are not very busy either.
Okay, underutilized capacity is exactly the kind of situation you want to have. I'm glad that's the way it is for you, Dr. Balal, and I hope that's the way it stays. For the moment, Dr. Ashish Jha, Director of the Howard Medical Center from Boston, Dr. Naresh Trehan from Medanta Medicity, and Dr. Balal from the Manipal Institute for joining us on this broadcast, for taking out time and making the effort of coming together, for your very, very valuable insight, because it's when doctors were taken so seriously and looked at with so much respect when they speak, it's then that people have something that they can hold on to. So I really appreciate you taking out time and joining us. Thank you very much, and I hope that over the next few days and hours, we'll have you back on our network for more conversations. Thank you.
Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.